in the hospitals that I work with, we have other machines, other tomographers, very, famous machines. But my preferred go-to machine is the 𝐾𝐢𝐬𝐜𝐶. I've purchased one for myself in my office. The 𝐾𝐢𝐬𝐜 is a very versatile machine. You can switch rapidly your mode from being a refractive surgeon to being a cataract surgeon. The IOL optimization software is superb. The scleral lens fitting, which is the new feature in the 𝐾𝐢𝐬𝐜, I do not use it that much because it's mainly the optometrists and the orthoptists that we do this. But having the ability to evaluate the patient regarding different modalities with the same machine. So if I have a patient that is a borderline patient between doing corneal refractive surgery or ICL, I can actually evaluate everything with a single press of a button with the same machine. This is very, very good. If I'm evaluating the same person or the same patient for a RELEX or a refractive lens exchange by the IOL optimization, I have everything in front of me, and it's all just, a drop box of different options that I can click on. The patient has done his scan, he can wait outside in the room, and I can evaluate everything. And this is something, it's like, a workhorse, a Swiss knife that does everything for you from one click. This is why I chose it to be the single diagnostic machine in my office. We all know that the higher order aberrations from the cornea that affect the vision are many, but in keratoconic patients, they are usually the coma, especially the vertical coma. And sometimes when we treat these patients, we opt to do what we call a selective higher order aberration treatment, which means that we only treat a single higher order aberration. So by doing this, you can actually simulate, if you get rid of this higher order aberration, how well will the patient see. And this will show us if this plan of us will work or not, number one. Number two, will show the patient what's expected after the surgery. So again, it enhances the experience of the doctor and the patient when we are treating complex cases. When you get the 𝐾𝐢𝐬𝐜𝐶, you're only thinking about tomography. So yes, it is a very good tomographer, it gives you very good scans and very good maps. But again, you should, as a doctor, explore more and more of the machine because it gives you many, many things, 100 different things. And not all of us use the 𝐾𝐢𝐬𝐜𝐶 to its full capacity. So I would always suggest, and I would always advise our colleagues that are going to purchase the 𝐾𝐢𝐬𝐜𝐶 is to use it more and more and more and explore things that they are not usually accustomed to. And this will give them a lot of ideas and a lot of options in treating their patients.